Ontario is doing a lot of testing, but the province is struggling to process them. Right now, there's a backlog of more than 26,000 tests. Global News has learned the province is launching a rapid training program which could put up to 600 workers into medical labs. That should help ease some of the strain. But as our chief investigative correspondent Carolyn Jarvis reports in this Global News exclusive, Ontario and the federal government have known about the labor shortage for years.
At the Michener Institute, labs that have been mostly dark during the pandemic will soon be buzzing with students. A fast-track program, 2 days online followed by 2 hours in this lab, will start cranking out new workers to address a labor shortage.
We're looking to those who already have a science background in microbiology. So these are learners who already have a university degree, either at the baccalaureate or master's level.
The program is funded by the Government of Ontario. Students who complete it will serve a supporting role in labs.
We built the platform to be able to scale up by the end of November, upwards of about 600 learners.
But these new auxiliary workers won't be able to analyze results. That's the role of a technologist.
We need qualified, licensed medical lab technologists who actually perform the test. And all the labs are vying for the same pool of individuals.
By some estimates, Ontario is short 200 to 300 lab technologists, certified workers who complete a 2 to 4 year program. Dr. Tony Mazzuli's lab at Toronto's Mount Sinai Hospital needs 15 more of them now.
We're running 24/7, so it isn't just one shift. We need people to cover 3 different shifts, 7 days a week, and that's where it's getting tight.
People are coming out of retirement while existing employees are putting in overtime and foregoing vacation. For some, the notion of a day off is laughable.
I think it was end of March or the beginning of April. There's some days where it's only been 8 hours, so I'm kind of happy about that, but on average it's way more than that. Yeah, 14 hours a day.
The frustration for many is that it didn't have to come to this.
70% of labs in Ontario were understaffed prior to the pandemic.
Industry associations have been asking governments for years to increase the capacity of lab training programs and warning of a retirement drain.
In Ontario, 50% can retire in the next 5 years, and many can retire now.
The strain falls to the front line with an unrelenting demand at the door. Carolyn Jarvis, Global News, Toronto.